Everybody. I'm Dr. Janine Hopkins, board certified dermatologist at Hopkins Dermatology. And it's right at 6 o'clock. And we are going to launch our second webinar for the evening. We just finished our South Lake, Texas webinar where we had our guest, Dr. Douglas Ferris, who's a dermatologist in my practice in that location. And we're now about to launch our second webinar, which is with the Monroe, Louisiana practice. So if I haven't met you before, which I can't imagine I haven't, because we invited all of our patients to this conference, but board certified dermatologist. I'm now celebrating my 30th year in practice. Launched my practice here in Monroe in 1996. And I will say that things have really expanded in the past 30 years, not only with the way I practice medicine and dermatology, but just the growth that my practice has enjoyed over these 30 years. So our topic for tonight is going to be wellness. We're looking at things from a different lens nowadays. It's not just waiting till people have illness or injury or aging and then trying to figure out ways to go back and repair. We're looking at how to reduce the illness, the aging, and really we're talking more about longevity and wellness at this point. And the reason this has become such a hot topic is that our scientists globally have really made strides both in research, genetic, evaluations, kind of seeing what's really going on in the body that helps keep us healthy. And when things start to change, what's really happening at a cellular level. So I'm going to go ahead and start my PowerPoint presentation. When we get further into the topic, I'm going to talk for about 20, 30 minutes about some of the information on wellness and longevity. And then I'll be introducing my nurse practitioners, Anna Grace Livingston and Rachel Lindsay, and they're also going to be discussing some very important information such as GLP-1s and the importance of these in our health, as well as some of the technology we have available in the practice. Okay, so I'm going to share my screen. And we'll start with our slide presentation. Okay, so as I mentioned, elevating our wellness from within is really our new focus. As a dermatologist, of course, we're always focused on our skin health and appearance. What can we do to improve our skin, reduce our risk for skin cancer, mitigate signs of aging using lasers and other skincare treatments and products. But over the last couple of decades, a lot of information and science has emerged showing that intracellularly and metabolically, our body ages with time. And partly it's because we have a reduced production of these little proteins that are called peptides. Naturally, peptides are part of our body's ability to rejuvenate itself. Think of these as like little messengers that circulate throughout the body, and they work to keep cells healthy. They keep cells more functional. They repair glitches that are occurring in cells so that they don't express some of the genetic mutations and some of the aging effects that occur. And so this is really important because traditionally we frame our work around fixing and repairing. Now we're trying to really work more towards prevention. And so this slide is really interesting to me as I've been doing research and reading about peptides and really how that correlates with our general health. I've observed in my investigation, my research, that we know that skin cancer incidence increases over time. A lot of the damage starts early in life when we start getting a lot of, cumulative UV exposure, sunburn, sun tanning, but we really start seeing increased incidence of skin cancer occurring around the 50s and 60s. If you look at this blue line, this shows us that normally our body at younger ages is going to produce higher levels of peptides. And peptides, again, are these little messenger cells that go into the body and they're produced in the body. And they work on helping to mitigate damage and repair. So we can see in this blue graph that over time our body makes less peptides. And then over time our body is at higher risk for skin cancer. And around that same age where the peptide levels are low, the skin cancer risk increases. So this is just an observation on the inverse relationship between peptide decline and the increased incidence of skin cancer. We can overlay this graph again, looking at other factors such as UV exposure and DNA damage. And you can see again, as our risk increases over time with DNA damage and cumulative UV exposure, the rate of skin cancer increases. But you also see that that correlates with the decline of these peptides that are basically produced in our body to help repair and rejuvenate. So this led us to look into what can we do at a metabolic level to help reduce aging, help reduce the risk of these damaging effects that occur over time. And peptides are basically available and have been, because the scientists are really smart, they've been able to make them into these proteins that we could either inject or we could get IV infusion. But for most people, that's not really accessible or practical. So IV infusion would obviously require people to come into clinics and once a month get IV infusions of peptides, or they would order these peptides from pharmacies and basically inject them. So again, not very accessible to many people or practical. So it wasn't until just last year that this company called Instamed actually came up with the first delivery method that allowed us to put peptides on these little strips that we put in our mouth, and they'll absorb through the oral mucosa directly into the blood system. So this company basically developed the technology that allows for oral transmucosal absorption of peptides. And that's really exciting because it takes away the need for injections or IV infusion. We know that peptides do not absorb well through the gastrointestinal system. These little proteins are very sensitive, so they don't absorb well through the GI tract because they get broken down by enzymes. And so that's why, the delivery method has really been limited to either injections or IVs to get them directly into the blood system until this company, Instamed, came out with this technology. So this has really been a breakthrough, making this much more accessible and user-friendly for people as far as wanting to improve their health and or appearance. So here's just a schematic of what the particular peptide I'm going to discuss next, called GHK copper, does at the level of the skin. First, we know that it can help stimulate collagen production. Loss of collagen is one of the reasons that our skin becomes more wrinkled and crinkled. We know for women in particular, estrogen is another important hormone that has a positive effect on our skin. And just around the time that we go through menopause and our hormone levels become depleted, we also see that there's a decline in the production of GHK copper peptide. So one way to help mitigate that effect on our skin with increased loss of collagen would be to supplement with GHK copper. We know from lots of studies that have been done in the medical literature that GHK copper is also very important for skin healing and wound healing. So for patients who have thin, fragile skin or wounding skin that heals slowly, this peptide in particular has been shown in scientific studies to help accelerate skin repair and healing and also improve skin renewal. So we've identified this particular peptide, GHK copper, as a regenerative peptide that supports your skin's natural repair process, supporting collagen production and helping your skin to repair, also by promoting healthier skin and hair. So with this particular peptide, you actually do 5 consecutive days, then you take 2 days off with your treatment, and you do this protocol for 12 weeks. It's not a peptide that you would take every day, all year round. Studies have shown that it's best used in this 5 days on, 2 days off protocol. And then after 12 weeks of treatment, you would take a break for a few months and then recycle back on it. So very easy for people to use as far as a way to improve their skin health and appearance. One of the companies we've actually worked with for several years now, almost a decade, is a company called Neova. They actually incorporate GHK copper into their skincare formula. There's other companies that do as well, but in particular, Neova has won scientific awards because their particular product has been shown to help reduce not only the visible signs of skin aging and sun damage, but also reduce the risk of skin cancer. So GHK copper, from dermatology perspective, is really an essential peptide for helping our skin health and appearance. The next peptide that's available through the Instamed company is this regenerative peptide that actually can help accelerate healing and recovery beyond skin. This would be something that would be helpful for people who've suffered either musculoskeletal injuries, people recovering from strains and torn ligaments, inflammation in joints. And this actually has been shown to promote and repair tissue at a cellular level, involving the musculoskeletal system as well as skin. So BPC 157, really important peptide when you're dealing with regenerative wound healing, that involves more than just skin, but also joints and tendons. This other peptide is really great, supporting natural hormone optimization and vitality. CJC 1295, ipamorelin, is one of the peptides available through Instamed to help again with collagen production, which we know is an important, structure in the skin. But also this helps improve sleep quality and it helps to support lean muscle mass. So this is great for people who are also taking GLP-1s. And in a few moments, Rachel, our nurse practitioner, is going to discuss the GLP-1s and their importance in helping people with basically improving their overall health as well as weight loss and diabetes and insulin resistance, which is important because that can lead to increased plaques and health issues. But this particular peptide, CJC 1295, ipamorelin, is great for people who are exercising, who are trying to prevent muscle loss, if they're on GLP-1s. And again, is one of the peptides available with this transoral delivery method. You probably have heard a lot, if you're keeping up with what's going on with longevity and wellness, about NAD. NAD is actually a coenzyme that works at a cellular level. It's essential for energy and longevity, but not just feeling energetic all day, but really energy at a cellular level and actually intracellular at the mitochondrial level. The mitochondria is the powerhouse of the cell, and NAD has been shown to help keep the mitochondria more active, functioning at a cellular level. And this also will help, not only boost cellular energy, but supports DNA repair. We know when DNA mutations occur, that can lead to malignancy. So supporting DNA repair is a really important part of the supplement NAD at a cellular level. This particular coenzyme has also been studied and has been shown to help enhance cognitive function. So people who are wanting to, help their brain stay sharp and alert, certainly NAD would be an important coenzyme to add into their anti-aging longevity protocol. Some of this you might see even at the health food stores and drugstores as an oral supplement. But again, as I mentioned at the beginning of the lecture, most of these peptides and proteins and coenzymes actually get broken down real easily through the GI tract and metabolized to the liver. So we've always, wanted to actually get optimization by using them directly into the blood system. So again, NAD can be either injected, it can be infused via IV, but now with the Instamed technology, it can be used as an oral trans absorption peptide. Glutathione, this is another hot topic in healthcare and longevity. We know that this is a super powerful antioxidant used for detox. We know our body gets exposed to a lot of chemicals every day, both through the food that's been overly processed, plastics, and just environmental toxins. So glutathione's been shown in lots of studies to actually help detox our bodies from some of these exogenous chemicals and toxins that we get exposed to. This in turn can help not only your skin clarity, but just your general overall well being by reducing oxidative stress. So that's an important antioxidant that you can get in certain foods, but also, through certain supplements. Thymosin alpha 1 is one of the peptides that actually helps boost your immune system. This one's important if you travel a lot or you're around people that are, sick right now, or you've been suffering from a lot of illnesses, and you really feel like your immune system needs some support. So thymosin is one of the peptides that you wouldn't really take every day all year round, but particularly helpful when you're either trying to recover from illness, you need your immune system to get boosted if you're traveling a lot or under a lot of stress. It helps reduce and balance inflammation, and that in turn promotes recovery. We know when we're using this terminology a lot right now in healthcare, it's called inflammaging. We know inflammation in the body is one of the really main culprits for illness and aging. So the more we can reduce inflammation with a healthy lifestyle, exercise, eating real whole foods, foods rich in nutrients, foods rich in antioxidants, and then supplementing that with vitamins and nutrients that can help reduce oxidative stress and inflammation is really important. And thymosin is one of those peptides that's been identified in helping to support the immune system and then reducing inflammation. Again, when Rachel goes into her discussion in just a few moments about the GLP-1s, we'll see that more and more scientific studies and data are supporting GLP-1's benefits in reducing inflammation in our body. And that in turn can help our patients be healthier and longer. PT141 is one of the peptides that's been shown to help support vitality, energy, performance, and also sexual well-being. It supports libido. Oxytocin is one of the feel-good hormones our body naturally produces. But as I mentioned, a lot of these peptides, which are naturally produced in our body and they're very abundant in our 20s, start to decline as early as the mid-30s. So again, the more decades you have behind your belt, the lower your peptide levels would be. So for people who are wanting to support their energy, their overall vitality, their libido, PT141 would be the peptide for you. This one, though, is not something that you do daily. It's also something that you would do just in short doses, particularly maybe 2 or 3 times a week at the most, and particularly around the time of day or night that you want to feel romantic and more intimate with your partner. So we know that in dermatology, the best results often come with a complete regimen. And so a lot of these peptides that I just mentioned that we're really excited to offer now at both of my locations of Hopkins Dermatology in both Monroe and Southlake, Texas, are used in combination with a lot of our medical grade skincare products. We like the products that have copper, with which I mentioned, Neova DNA Repair, but we also have some of the products that are in my skincare line. The Alphabet Serum has a lot of the antioxidants, which are both polyphenol, vitamin C, and then we have a Calm product, which is great reducing inflammation in the skin. And we combine these peptides that can be taken as a little transoral peptide patch with our skincare products to really give our patients optimal improvement. Again, these are often combined in my practices with some of the procedures that we offer, particularly our Protonal laser treatments that we use to rejuvenate the skin. One of my colleagues, Dr. Matt Avram at Harvard, has been publishing over the last several years a lot of data that shows many of the skincare procedures we perform with laser procedures, particularly the fractionated laser treatments or photodynamic therapy, actually have been reducing the risk of patients' skin cancer while also improving the health and appearance of their skin. So, as your dermatologist, this is a really important part of how we are looking at longevity and improving not only your appearance, but your health, which is really our most important part of our practice in healthcare is again, not just focusing on, looking good, but also how are we going to help you with your skin health, as well as your appearance and your overall wellness and longevity. So excited to bring this information to you. And I hope this format of a webinar has been helpful because, we know not everyone's able to make an appointment to come in for consultation to hear all this information from each one of us. And we thought the format might be very helpful tonight to give you oversight on what we're offering in the practice and some of the new science and technology that's available. So next up, I'm going to introduce Rachel Lindsay. Rachel is new to my practice. She started back in the summer of 2025, and she's just been going gangbusters at helping our patients, both the littles. So she came in as a pediatric nurse that then has expanded her role or into our nurse practitioner, helping children with their skin problems like eczema, warts, molluscum. But she's also had a history and background in actually using IV therapy for people, infusing things like the peptides and keeping their metabolic health optimal with supplements with nutrients and with vitamins. So Rachel's really, jumped right in and helping expanding our practice to offering other things such as GLP-1 and nutritional support with the peptides. Also, she's been working along with Anna Grace, who I think many of you already know, my nurse practitioner of at least 10 years, going on 10, helping our patients, get optimal care. And so, Rachel, I'm going to turn it over to you right now. And Rachel's going to give you all a lot of information on the benefits of the glucagon-like proteins that are used now, not only for treating diabetes and obesity, but a lot of research showing their benefits in improving longevity by reducing inflammation in the body. So, Rachel, I'm going to turn it over to you.
Hey Rachel, we can't hear you.
Well, like most webinars, we're having a little technical difficulty. Um, on our previous webinar, we had a hacker jump on. I've never had that happen in the past 5 years of doing multiple webinars, but we did have a little incident previously. So maybe Rachel can hop on in just a minute. She's got to get her speaker working. In the meantime, Anna Grace, maybe you're in there with Rachel. Yeah, maybe sharing the same laptop. But if not, we could have Anna Grace go ahead and discuss some interesting information. Or actually, I'll give y'all a little bit more. Oh, there's Anna Grace. Yeah,
So,
we'll jump to Anna Grace while Rachel's getting ready. So Anna Grace is going to give y'all some really great information on
Mhm.
a device that we have available at Hopkins Dermatology for body contouring and toning. So Anna Grace, take it away.
Yes, I'm speaking tonight about our Emerald laser system, which we have had. Doc and I were kind of looking at each other yesterday, trying to calculate when we actually got the Emerald, and I think we're almost close to having it for 2 years now. But the Emerald laser, it is, in fact, as it says, it is a green wavelength of light, specifically 532 nanometer non-thermal green laser. Now, what sets Emerald apart? I have to give a little bit of a backstory, because if you've been a patient of ours for years, you know that Dr. Hopkins always tries to bring in the best and newest devices. And we have had, I will say, in my career here, a few different fat loss devices. We have had them that will heat the tissue up to try to destroy the fat. There was one years ago that would try to take the temperature down to freeze the fat cells. And then we've also used actually all three of the other type that can actually use ultrasound therapy to help destroy the fat. So all three things that you just heard me list all had the word destroy in them, because that has been kind of the technology that has been available, is that if we heat it up or lower the temperature or ultrasound it, we can destroy it and get rid of fat. But we also have to appreciate fat does have a purpose in our body. God did not just put it there to make us look ways we don't want to look or look too fluffy. We know that our fat in our body helps support our muscles. It actually helps with our metabolism, our hormone regulation. So it's really important to figure out how can we just optimize this fat? How can we make it to the proper thickness that we want it to be, basically just better for your metabolic health. So this laser, the studies, when I was looking back to talk on this, all the studies, I mean, we've over a decade, we've had the science. It's just then how is it available, FDA approval, and then the Emerald laser came about. So when Dr. Hopkins brought this laser, this idea, she heard about it at a conference, as she does most all of her ideas. When she came to the office, I remember her saying, "There's a laser and it doesn't hurt and it gets rid of fat." And I know some people always say, if it's too good to be true, it's probably too good to be true. And I remember specifically her husband, who financially takes care of everything in the office, was kind of trying to pump the brakes because in the past with our different devices, patients are always eager to sign up for the fat loss devices, but it's also, can we tolerate it? How badly does it hurt? And we would have people that didn't necessarily want to finish their treatments because it was uncomfortable. So I remember her husband saying, "Well, if we bring this in, I'm going to be the first on the table to give it a trial run." And we were all in their training. We had been minutes into the treatment, and I remember him saying, "Y'all let me know when you actually turn the device on." And he had been minutes into the treatment. So that right there, I think, sold me, because it was. I've administered the other treatments, and if it's only as good as if you can tolerate it. And I've definitely felt the device, and some patients will tell you that there's warmth, like you can tell that there's something happening, but generally no one complains of anything. So what this laser does, it's a 30-minute treatment. We do know that you have to roughly at least have 10 treatments. I think optimal results in the studies and clinically for us have been between 10 to 12 treatments. That does not mean you have to stop there, but that is where most of the studies really had the optimal results. I know in the original studies, they did take patients with a higher BMI. So a lot of our actual published data goes between patients with between 30 to 40 BMI. And they saw that the median average inches that were lost were roughly 6 inches. I know here in our practice, we have had similar results, and that is cumulative. So I maybe need to backtrack on that. So not necessarily 6 inches in the stomach. That was, around their thigh, waist, hip area, cumulatively 6 inches. Now, that is something that's important to know because I've had patients come consult with me and say, "Well, can I just do my stomach and maybe my neck, or just the back of my arms and my stomach?" All the data and the best information is when we treat the front and the back of the patient. So treating 15 minutes on the front and 15 minutes on the back. Now, can you then go treat your arms in a separate session, or then treat the submental fullness in another session? Of course you can. But the most difficult part truly of this treatment is that you need to come twice a week. And that's just a scheduling thing, because we know that 2 to 3 times a week for those 10 treatments is optimal. So it's patients finding the time to be able to come up here and do that. So how it actually works when we place this green laser around you, the laser energy creates little tiny pores or fractions, I guess you could call it, or channels for the fat cell to leak. So in the fat cell, a nice plump fat cell that we'd like to get rid of is full of triglycerides and fatty acids. So think of, if you were a visual person, like a big grape that our goal is to turn into a raisin. So the laser creates those little pores and channels to help the fat cell leak out. So then your lymphatic system can flush out what we don't want to be there. And then circling back to, you've got the very healthy fat cell there that you would have liked the whole time. So in speaking to that there's no pain, that truly goes with, you don't have swelling after, you don't have bruising after, redness, all of the things that I think most patients would assume or be concerned about. So we, in order to optimize your lymphatic drainage after that, immediately will put you on a vibration plate after your treatment. We heavily encourage you, as you leave, like, go on a walk, if you have a vibration plate at home, use that, because the healthier your lymphatic system is throughout this treatment, the better your results will be. So lots of water. That's kind of the gist of how the treatment works. We do have our laser technician that performs this treatment. You're measured as you come in, and kind of going and segueing into what Rachel's going to talk about. This really pairs beautifully with GLPs, because we do know with this laser, we actually can see a skin tightening effect, and there's actually some information on cellulite reduction. So it pairs beautifully with GLPs, which is kind of one reason we started bringing GLPs into practice to begin with, because we have just a large amount of patients that want to look better and feel better. So I don't know if we're taking questions at the end of this, but we absolutely do consultations on the Emerald laser. It segues, patients ask us about it throughout clinic. So if you're a patient of ours, and you're interested in this, I'd love to talk more about it to you. Or if you are new to us and want to talk about this option, I'd love to have you. So I think now I will be turning it over to Rachel. Rachel, we are in the same room. So are you good now, Rachel?
Okay, can anybody hear me?
We can hear you through Anna Grace's computer.
All right, I was gonna thank you, Anna Grace. That was a great presentation, and yeah, we do appreciate the benefit of the Emerald laser. I will say, with any procedure, the rate limiting step is always pain, and whether or not it's tolerable. So, yeah, for a while we did that True Sculpt ID, and even though it worked, it was quite hot and uncomfortable. So the Emerald laser, exciting technology. In other words, helping to contour and tone without pain. So now, Rachel, over to you. We're ready to hear a lot of information and updates on GLP-1s. Hot topic.
She's coming to my screen, everybody.
Okay, hello everyone. I'm Rachel. Sorry about the mix-up, but yep, technology. That's it for you for sure. Well, I first wanted to say thank you to everyone. I have learned so much here at Hopkins Dermatology, and I am ready to learn more. But like Dr. Hopkins said, I love taking care of everyone from the littlest little to the biggest big. It doesn't matter to me. I will take care of you. I have also personally walked through a GLP journey myself, so I have a little personal, knowledge as well. But truly, I want to talk to you about the inflammation and the metabolic health, and how it's all connected together, which is just so amazing in my opinion. It's going to help improve multiple aspects of your health, not just weight loss, which I think is great. We kind of discussed a lot tonight about inflammation. That's like the buzzword, inflammation. And I feel like in the day and age that we live in, we are constantly exposed to things that we weren't exposed to years ago. And I think that affects our health. And in turn, it affects our inflammation and how much inflammation we have in our body. Weight gain, obesity, insulin resistance, in turn, type 2 diabetes, cardiovascular health, all of those things play a part in having too much inflammation. It's not just one isolated issue, it's multiple issues, and they're all connected. They're all connected with that inflammation pathway. So for that, I want to talk about also, it affects your hormone imbalance. It affects your long-term health. So your knees that hurt when you walk, those kinds of things. That's not just the weight that's on you, it's the inflammation in your joints. So I'm sure everyone here has probably heard of GLPs, maybe even been on one before. The ones that we mainly are going to discuss tonight are the semaglutide and the tirzepatide. Those are the two main ones. Tirzepatide is of the newer generation. So that's the one I really like. That's the one that I've done the most research with. I've found the best results with as well. How it works is it increases your insulin release when you need it, not all the time, just when you need it, when your body actually needs it. It decreases glucagon, which raises your blood sugar up and makes you feel like I need to eat. And so then it also slows. This is where it really gets to people whenever they're on it. they feel like they don't need to eat, right? And so that's that slowing of the stomach emptying, okay? So therefore, reducing your appetite and reducing your cravings that you have. And so then it, sends it to your brain, and your brain says, you're not hungry. So it's going to really benefit you metabolically, like we talked about, but also in the long run, it's going to benefit you in your cardiovascular space, and your inflammation, like we already talked about. And so it's a really, really powerful tool. And I'm really excited to start doing this. This is going to be awesome. So, what does that mean for you at Hopkins Dermatology? That means improved metabolic health. That means reduced inflammation. That means you're going to feel better overall as an entire human, top to bottom. And then long-term results. We're going to walk with you this entire time from start to finish. You get access to us as much as you may need. And so what that means here is, just like Anna Grace talked about with, the laser, we will consult you and we will take measurements and we will take pictures and we will get your weight and your BMI, and we want to know lab work. We want to make sure that you are as healthy as you can be and that we optimize on that health, okay? And then we will decide together what the best GLP is for you. And we will discuss also the combination with the Emerald laser. If that's something that you are truly wanting to do, that is a great option, because I will say, as far as side effects go, you're going to lose this weight and you still might have that skin that's still there and it's pesky. So the Emerald laser is a beautiful pairing device to work with these GLPs. It's wonderful. Also the peptides, which I love to pair as well. I'm really excited about that too, Dr. Hopkins. And then we do regular follow-up, and we're going to do labs, and we're going to keep with that progression and keep with that tracking. The main core focus, just a real big, like a real small snippet, would be, your nutrients, your hydration, your fiber, and then your strength training. I think a lot of people get concerned with losing muscle, and that's understandable. But the research shows that if you continuously do your strength training and make sure that you exercise and you're drinking your water and you're staying on top of your protein intake, that you should not lose that muscle. You can lose the fat, which is what we want, but the muscle should stay. So I think there's something to that. We will go over common side effects. We will go over all the questions that you may have. And like I said, we're going to walk step by step with you on this journey. At this point in time, I really don't have anything else to add. Dr. Hopkins, do you have anything?
Oh, yeah. I always have something to add. I'm answering a question right now in our chat box. It's a good question. I appreciate our patient asking. Was basically, do you have to be overweight to be on a GLP-1? And the answer is going to be no. We can use GLP-1 responsibly. I'm using that word because we are going to be responsible for any off-label use, but we would use a GLP-1 off-label responsibly to improve someone's metabolic health. Right now, there are only a limited number of FDA indications, obesity and type 2 diabetes. I did give an interview not too long ago regarding the use of GLP-1s for treating psoriasis, because data was coming out in our medical literature that tirzepatide or GLP-1s may be beneficial in helping patients with psoriasis, which is inflammatory skin disease. We know there's a lot of going on with psoriasis of the skin. It also can affect the joints. We've known for quite a while now that part of the underlying problem with psoriasis is inflammation. They have a higher incidence of metabolic syndrome, which includes heart disease. I mentioned the arthritis. And then when we put them on the FDA-approved drugs that are called biologics, it actually not only clears their skin, but it improves their overall health. even studies showing it reduces risk of heart disease and their joints get better. So that's a drug category called biologics. So there was data that was pulled into the medical literature about GLP-1s in psoriatic patients. And overall, we know that now, based on the data, it's because GLP-1s are helping to reduce that inflammation. So what we would say, specifically, is that it wouldn't be an FDA approved indication, but improving your metabolic health would be a reason that we may consider adding it into a person's treatment protocol. The dosing would be appropriate so that someone who's not overweight or obese, maybe their BMI is less than 30, but at BMI of 27 or so with other metabolic problems could be an indication. The problem is your insurance company probably wouldn't cover it, so it would be an out-of-pocket or treatment rather. In Monroe, we have been working closely with the pharmacist at Community Pharmacy. And again, they're very much into longevity and health as we are at Hopkins Dermatology. So we've been working with that pharmacy group on making sure again, we're sourcing really reliable medications and treatments that are, shown to be effective for our patients. So that's important for us as well. Let's see, are there any other questions? There's a few things popping up. Oh, great question. Okay, so let's talk about this. We see patients coming in for hair loss all day long. And we do a test in our practice now that's called Tricho test. It's one of the first genetic tests that literally identifies individually what your genetic predisposition is for hair loss. And not only that, what treatment would best help you with hair loss. So all day long now, we're doing these little swabs inside our patients' mouths. We're sending it to a lab that does these certified tests. It's called Tricho test. And we're getting a report back about 2 weeks later, and it literally shows us what that person needs to help reduce hair loss and stimulate new hair growth, whether it's prescription like minoxidil, spironolactone, finasteride, dutasteride, or a topical serum, or even just which vitamin supplements are going to best help you with hair loss. We can do that genetically now. But the side effect of GLP-1 for hair loss, the data on that is still kind of questionable. Is it a direct effect on the hair follicle, or is there something else going on metabolically? And I think most of us agree that it's more of a metabolic side effect. As Rachel mentioned, part of the weight loss for GLP-1 comes from decreased appetite. And then people just stop eating as much food. Well, the problem with that is food is nutrition. Nutrition are building blocks. We've got to have it, or we kind of go into starvation. And our body doesn't need to be deprived of nutrients that we need for building blocks. We should all be choosing whole foods. We don't need to eat the cupcakes. We don't need to eat the donuts. All the sugar is toxic. We know this, but we wanted no, it can't be the cupcakes. It can't be the cookies because they taste so darn good. But it is the problem. And it is a direct relationship to our skin health and our weight and our overall health and metabolism. So the problem, and going back to how the GLP-1s help people lose weight, well, if it decreases your appetite, you're not hungry, you don't eat, you start losing weight, aka pounds come off and fat's reduced. But then here's the side effect. You start losing your hair because you don't get enough protein in your diet. You need hair, you need protein to make hair, you need these amino acids. And then same thing with the loss of muscle mass. If you're not exercising, you're not building muscle anyway. And if you start losing weight without an exercise program in place, then you are going to see more than just weight loss of unwanted fatty tissue. You're going to start getting weakness and muscle loss because, again, you don't have an exercise program in place, but also you're not getting enough protein in your diet. So in our webinar that we just finished, and if y'all are very interested in learning more about nutrition and health, we'll have Dr. Ferris's segment of our webinar available on our website, so you can listen to his very informative information about nutrition and supplements. But you've got to get enough protein in your diet to have a healthy body. And the dose of protein You take your body weight divided by 2, so that's about your kilogram weight, and you multiply that times 1.6, and that's how much protein you need in your diet every day. So that means we're all probably protein deficient right now. We'll eat some protein in a few minutes, a steak, some chicken, eggs, yogurt. I mean, there's just numerous sources of protein. But for people in particular who are on GLP-1s, and people who are trying to heal from wounds and injury, I treat a lot of skin cancer patients. We have this wonderful technology called image guided radiation therapy. We're destroying cancer without surgery, but they need to heal. So we coach our patients, a lot of whom are seniors, who are literally protein deficient because they don't eat enough. One of my patients today says she only eats 2 meals a day, and there's no way she's getting 50 grams of protein in each of those 2 meals. But you need to be getting, on average, most of us, depending on your weight, um, needs somewhere between 75 and 120 grams of protein a day. So that means each meal's got to have 25 grams if you're eating 3 times a day. Then you need about a 25 gram snack. And if that doesn't add up, to be at least 100, then you probably need to put a scoop or two of protein in your coffee or your smoothie. So to, kind of huge around the bush answer to that question, yes, you can get hair loss on GLP-1s. In my medical opinion, based on what I've read in the medical literature, it is probably not a direct effect of the GLP-1 on the hair follicle or the bulb as much as just a nutritional deficiency from decreased intake of nutrients such as amino acids. And I haven't seen any science to show yet that the GLP-1s inhibit the hair growth cycle. But again, more research needs to be done on that as well. So that's exciting. Anna Grace, did you say if I had anything to add, or was that you, Rachel? Yeah, lots to add. What other questions? We still have about 10 or 15 more minutes to go into some questions if y'all have any more. If not, we really appreciate everyone who attended tonight. And I really appreciate my two very smart and brilliant nurse practitioners. Great to have a team here at Hopkins Dermatology that is willing to follow me into the wellness part of medicine and healthcare. Again, as I mentioned, when I was growing up in dermatology and healthcare and medical school back in the 1900s, we basically focused on you're already sick, you're already ill, let's, prescribe you something to fix it. And I think the real shift is that, wait a minute, can we actually help people prevent disease, prevent illness, prevent cancer? And as a dermatologist, it's not enough to just say put on sunscreen. I mean, obviously, we're going to recommend you do that because you need to limit your UV exposure. We know it mutates the skin cells. We want you to use antioxidants topically, take them orally. Now we've got the peptides that are finally available and in a way that's accessible to people who don't want to do a shot or an IV. Now we have them not only in topical treatment form, such as our Neova DNA Repair Complex, but we also have them in these Instamed peptides. So we're really excited about saying, okay, let's take, the bull by the horns. Let's go into the deep science. And there's so much information out there. As I've been reading lots of journal articles and research articles in the medical literature, I even felt a little bit just kind of angry the other night that this isn't something that we've really been talking more about and offering more to our patients, because I do think we can prevent a lot of the diseases that people have now, a lot of the illnesses, a lot of the cancers, if we're doing things right on the front end. And it doesn't mean that if you're already, age 50 to 60, that you missed the boat. I didn't miss the boat. We want to make sure that, at all ages and stages of life, that we're taking care of our patients' metabolic needs, their skincare needs. Obviously, the sooner we start childhood in protecting against UV damage, into the 20s and 30s, when you're still making, plenty of peptides, but you can eat healthier. It's not enough to say, well, I'll get away with this as far as long as I can. I'll eat these cupcakes and donuts until they catch up with me, because they're going to catch up with you. You can't outrun a donut. It's going to get you at some point in time. So, eating healthy, exercising, making smart life choices, using sunscreen, wearing some protective clothing. We're definitely going to continue to advocate smart lifestyle choices. But now that we have all this really super smart science showing us that we can actually help regenerate our body by incorporating peptides, by incorporating some of these, anti-inflammatory medications that now go into the title of GLP-1s, I think we're going to see hopefully a healthier population in the future. So, oh wait, there's another question. Information on the peptides that we offer on our website. Yes, there is. Let me pull up my PowerPoint again if I can. It's InstaMed. I'm just going to type it in the message. This company just launched this last year in 2025. Just a little fun story. I have this pharmaceutical rep, he used to call me for years. And I put him in my phone as Just Jack because Just Jack's full of energy. And when he used to call him, it was always something new and exciting going on. Hadn't heard from him in a long time. And my phone went off a few months ago. Just Jack texted me and said, Dr. Hopkins, I'm now with this company. We're launching these peptides. It's the first company to come up with this technology that you can use, these absorbable peptides just right through the oral mucosa. And I thought about you because I know you like to stay on the cutting edge of everything new and innovative. So it was funny because it was right before my birthday that we got the first order of these Instamed peptides in. So even though I think I got it for myself, I'm willing to share with all of you because I do think this is really great science. Matter of fact, one of my last conferences I was lecturing at in Portugal, it's called Five Continent Congress. It's an international meeting. So doctors from all over the world in different specialties get together and we lecture and learn about things that are, new and innovative. And so one of our forums was a morning session on longevity, health span. What we're talking about now is, not just living longer, but living healthier longer. And so the health span lecture was really interesting because it gave us, insight on what we're doing globally to help people live healthier and better. And one of the colleagues is this German oncologist, and he treats a lot of, he's a gynecologist who does oncology. And he was even talking about doing IV peptides, helping his patients who are going through cancer treatment. So we've known for quite a while now that, this is really great science, and we're hoping now that it's accessible to people. It's an easy format in order to, get this into your body without having to do with shots and IV infusions, which we're not above offering. I love a little Botox shot every now and then and some filler. But yeah, when it's every day, it makes it a little harder for people to do that. But yeah, so InstaMed Peptides are the company that we're working with to offer these to our patients. All right. Any other comments or questions from my nurse practitioner team?
I don't think so. Thank you, Doc.
Yeah.
Well, thank
We're here
you.
to help y'all with whatever y'all need.
Yeah, great. Oh, wait, there's another. Oh, there was just a comment. So thank you. I do just think the take-home message tonight is that, this is not really just about anti-aging and looking younger. This is literally about building a healthier body and maintaining a healthier body. And if we can, do anything that would at some point help reduce someone's chance of getting skin cancer or other malignancies, or feel better, have more energy, self-confidence is important. I started offering hormone replacement therapy 5.5 years ago when I realized that, gosh, here I am doing all these wonderful anti-aging procedures in my practice, injecting with fillers, doing innovative laser procedures, neurotoxins so you don't look angry or worried. But yet, one of the major causes of skin aging for women in particular is hormone deficiency. If we don't have enough estrogen, then our skin just starts to age at an accelerated rate. It's called estrogen deficient skin syndrome. And we're losing 30% of our collagen within the first 5 years of menopause. So then it seemed to me almost irresponsible that if I wasn't addressing my patient's hormone deficiency, but I'm giving her injections and laser, I'm not really taking care of the big picture. So I went from saying, the trinity of anti-aging being lasers and fillers and neurotoxins to now saying the four pillars, including hormone replacement therapy. And now we can put peptides in that fourth pillar as well. And this is for men and women. Men need just as much attention for their skin as we women do. A lot of my guys who like to play tennis and golf and work out in the yard and fish are also battling skin cancer. So we're hoping that this is going to benefit patients of all ages and stages of life. All right. Well, I think that might wrap it up, everybody. If you do have more questions, feel free to email. Molly Claire will put the email on the comments here. I think all of you probably know how to get in touch with us. But yeah, feel free to book an appointment and come in and see us so we can keep you healthy longer and looking and feeling your best. All right. Good night. Thank you.